So good afternoon, Dr. Abbas. First of all, congratulations for your NEET SS rank achievement, and I would say more than that, that completing MD itself is an achievement. So both are, I think, worth praising. And today we will just have interaction with you, and the purpose is simply that we want to guide our student through the journey of medicine as well as MCQ. So that will be the total part. And before we start, I would like to hear from you regarding your college and have you started. So people will come to know from where you belong, and if in case they need to connect to you, I will provide details also, but you also can tell. So let's start with that first.
Sir, I thank you, sir, for helping me through the journey, sir. Sir, my name is Abhash, and sir, I started my UG from MMC Delhi in 2014 batch. So then I subsequently took 1 year of drop, and then I got selected in MD Medicine, BRD Medical College, that is located in Gorakhpur. So this was my first attempt in NEET SS
Okay.
2024, and sir, I got a rank of 69, sir.
Okay, that's great. So I think before, like the way people go that what after the NEET assess, I really want to go little retrospect. Why medicine?
So, medicine always intrigued me, sir, every time. Sir, first posting I had was in second year, we're not that serious. The third year, we started presenting cases, and I really loved the medicine ward, sir.
Oh,
Presenting cases, and it was some sort of Sherlock-like thing. So I really like that.
okay. So I
That
think what we have seen even throughout your MedCAS journey, you have presented many cases and all.
yes,
So that being non-biased towards specialty is more important, and I think that is
yes,
what we can see with your part also, that you have presented neurology case, cardiology case, and almost everything you took equal interest, and that I feel still is a very common message, that you might have decided specialty from starting, but without medicine there is no alternate at present. So I
yes,
think
sir.
that was the most important point we want to focus. Now we'll come to the point where students are actually interested, and then we'll again go back to medicine. Regarding your NEET SS preparation, if I ask that at what point of your residency you felt that now you should go towards this preparation, and what was your first approach to that?
Sir, when I started in first year, sir, there were no much. I didn't know much about NEET SS, sir. Sir, our seniors also were, sir, seniors who didn't. Our was a 15 people batch, sir,
Okay.
and our seniors were only 5 people, sir.
Okay.
So many of them didn't crack NEET SS. We didn't have any guidance about NEET SS, sir.
Okay.
So, sir, in first year, the duties were very hectic, so I couldn't prepare very much. But since second year, when I started presenting cases and I started looking through the MCQs and the question papers, I realized that I had to do it. And so, in the first attempt only, I planned that I would
Okay.
try to crack it. So,
Okay. So I think the message is like earlier we plan, better it becomes. But here again, the common questions we get as we interact with students, there is some discrepancy when it comes to your clinics plus theory and MCQ. So how you maintain that balance, that your theory part also goes okay, and practical, as we know, there is like we have to be good at that both the way, clinically for patient care as well as exam. There is no alternate. Practicals, people still feel little tough compared to the theory part. So how did you mix this preparation where everything is respected in a way?
sir, our presentations in our college, presentation started in first year itself, sir.
Oh, great.
Sir, I still remember I presented my first case of posterior circulation stroke on MedCAS only, sir.
Correct.
Abhishek sir took that
Yes.
case, sir.
Yes.
So it was my first case, and sir, I always had this thing that I have to present as many cases, sir. Because in when we present one case, sir, we learn a lot. We have to prepare a lot. There are many DDs we have to think, and it's all of a journey we take with the patient when we take history and things. So, sir, more first year, second year were clinic based. I thought, yeah, I should make more and more diagnosis. The majority of diagnosis I wanted to make in first and second year. So that in third year, I have to read books. So in first year, second year, I planned that I will more focus on clinics and sir, ward work.
Okay. And now this is also a common question that Duties are there, and I think that is never an excuse that work is the first priority. But along with in final year with duties, you have thesis also, you have exam pressure building up. And one approach what I liked about you is you started presenting case very early. So in final year, I think you are a bit relieved compared to what the peers feel. And even we had same during our MD that from second year we start presenting case. So third year you are confident enough to do that. And in exam you do not have much pressure on that. But how did you manage your time when the exam including theory is on mind, you have thesis in mind, and the duties are ongoing? Of course junior helps, but what was your strategy there?
Sir, in second year when we started reading like properly books, sir, I was focused on just the ward cases, sir.
Okay.
Sir, we had a good load of patients, sir. Every day, almost 100, patients were getting admitted, sir.
Okay, great.
And sir, we used to work it up and we used to read cases, sir. I still remember I asked you about one adult onset disease patient, sir. And this was the question in NEET assess also. The first question in NEET assess was adult onset disease. So, sir, I don't think the NEET assess paper and residency is different. If you do your residency
Same.
very properly and very authentically, I don't think we will have problem later. This time the paper was very clinical, sir. It was very clinical.
Oh,
They
great.
had many case questions and even Rumat was very much case based.
Okay.
There was one question, sir, psoriatic arthritis one. Is it psoriasis needs to be present or not before arthritis? So, sir,
Okay.
you classically told in your class, I remember, sir, you speaking in your class that sorry, in 15% cases only psoriasis is
True.
can be present after arthritis develops.
Right. So I think
Sir, what-
this is a very important message what you are giving. And I think we all agree, our common mentor Sudha ma'am has told many times that the teaching has three layers. First from patient, second from your books, and the third most important what I feel is the peers from the colleagues, teachers, and from whatever sources you are getting. So if patient becomes the first, I think the ultimate aim of being a physician is fulfilled. The rank comes and rank matters. That is obvious. But I think you have taken the right path and we are actually proud. And I remember that you have texted and many students text us message that there is a case and we try to follow on guidance rather than the ultimate treatment because individual treatment is not possible when we do not see patient, but the guidance sometime I think can help. And more importantly I feel is again with this video we would like to give that message also. The team MedCAS feels really proud, uh, of course with rank, but more than that when a student message and with this concept I solved this case and I helped that patient. I think that was the ultimate goal we have started, and I think we are doing that, and we can see with many students as you are doing great with this, and I think that has helped. Now I'll come to the part for your reading resources, and at this point, though we are discussing on Medcast platform, you can be very frank, honest that whatever you used, because ultimately I need all the MD students to be helped by this. So what were your reading resources during residency, and how you actually did that MCQ part and book does not match all the time. So how you utilize the things?
Sir, in first year, as my senior said from other colleges, you have to, if you are in the ward, sir, our duties were very hectic, sir. It was 40 hours almost every single day. Every day, alternative, we had 40 hours because because in started we only joined five people, sir.
Okay.
So I said I knew that I couldn't get any time to read books, sir. So I thought I should take up to date. I took up to date and I was just reading the question, reading the cases that I saw. That if I saw the HE case, I would see HE treatment, I would see HRS treatment, I would see other treatment that the patient would be there. My seniors would diagnose the case. I would just see the treatment while I was doing the ward work, sir.
Okay.
That was my approach in first year, just reading up to date whenever I get time, sir.
Okay. Okay. Okay.
And during rounds, sir, sometimes, like our seniors told us to examine the patients, I would just see YouTube video or just read a book for some sort of time, small amount of time, and just examine the cases, sir. In first year, we just need to do the ward work and be present in the rounds, sir. Just keep our eyes open and our ears open in the round. That's enough, sir, in the first year.
Okay. And how did you come with the Harrison? Because we, I think in MD we all have that dream. Some have in MBBS also that let's complete Harrison cover to cover. Okay. Even the platform what we did, that was the plan. Ki how can we help with that? But how was your approach to do with Harrison? And a very honest question I'm asking: did you complete the Harrison?
No, sir,
Okay.
not even close, sir.
Yeah.
The max I could get was 60-70%. Sir. I have not completed
That is
100%.
really good. 67 is really good.
60%, sir.
Okay.
Sir, I started my Harrison reading from second year.
Okay.
I couldn't read in first year. Only acute pancreatitis I read and some basic cases I read.
Okay.
Not major, but I was not reading system wise that time. I was just reading patient wise. In second year, I started with cardiology and neurology, and sir, subsequently I started reading. But sir, I would like to say that uh, just reading Harrison is not enough. You can never gain the information that is provided in the Harrison if you don't add it on with some video or some notes, because
Okay.
Harrison information is very vast. So, like in the malabsorption chapter, there is given that if a patient with suspected iron deficiency anemia comes, and you are not finding a cause, then you have to rule out celiac, and that one line means a lot for patients itself. I've diagnosed two celiac patients by that line only. But
Okay.
that line, I don't think so. People will register just by reading it.
Agree.
So that's where MedCAS helped me a lot, sir. You only taught, sir, malabsorption syndrome. I've watched this video like 3-4 times, sir.
Okay.
Tropicals through Whipples.
Right.
So, sir, I feel that first you should see some video, whatever you feel like, and then approach, then get back to Harrison. Because, sir, Harrison almost has everything. If
Okay.
you ever feel that Harrison doesn't have everything, you just go to the table and you will surely find that
Agree.
thing.
Agree.
Yes.
So I think Harrison is your key source, and even you will recommend to your colleagues and
Yes.
juniors that that is the key book. And I think
Yes.
that also matters because uh, there we have a lot of information, including if we say the video sources and all. But if we have one base ready, that everything what we read ultimately should convert to making Harrison easy, I think then the things becomes fine. Now, with your NEET SS experience, how do you feel that how much Harrison does it represent?
So it's the majority of Harrison, sir. This time also, people would say that it was not from Harrison. But, sir, what I felt was it was extension of Harrison.
Okay.
If you have read the Harrison, solved some MCQs, and seen cases, if you have just read Harrison, not seen cases, then also you couldn't solve that case, sir.
Okay.
But if you read Harrison and worked up the cases, I'm damn sure that you would do well in this exam, sir.
Okay. Okay. Now I will go towards MedCAS in your journey that you are with us, I think, for a long time, more than 2 years. And
Yes.
I just really want to ask that somehow MedCAS is not only about app. The WhatsApp group is quite dynamic, and the app really works there for providing what is being done, and then it comes. So how did you utilize MedCAS, and how did it help you?
So I took MedCAS in mid of my second year, so when I started Harrison. So one of my friends who is doing his residency from Ames Delhi recommended it. So, and so when I took it, sir, I talked to you also that time, sir. You were very approachable, sir, that time. You have been very approachable since my 2 years of residency, sir. And some of the videos are very nice. Sir, rheumatology is very nicely covered. Sir, vasculitis, sir, which age you need to suspect. Because, sir, sometimes we have so many DDs, we can't just put it in our mind. And if we know that what age group it defines and what female male ratio it defines, you can just narrow on the diagnosis. Like vaginosis is present in middle aged people, male female are equal. So those things really Medcast helped me. So Medcast is just not for PG preparation. It's more of clinical based, and if you want to approach patient approach, sir, it helps in NEET SS also. But, sir, I would say just because of Medcast, I have saved at least 10 patients, the 10 to 12 patients I've saved, so
That's
which I don't think I could have diagnosed, sir.
okay.
And you also, sir, helped like MCDD cutoff, sir, and many things, sir. Rheumatology things are very nice. Even, sir, Abhishek sir's class on spinal cord approach, the 3-4 videos, it is like, sir, very boon for, sir, like the people who want to present the cases in the ward, sir. It's very approachable things, sir. And the approach part also, sir, of the Harrison, I thought I couldn't cover it, sir. So I covered it from, sir, your platform only, sir. I didn't read it from Harrison, the approach part, sir.
So most of the class, I think, are still prepared that it's very common instructions for us that Harrison should be based, and then because the medicine is advancing like crazy. So we have to adapt the new things, but the base should be Harrison. Now I'll ask last few questions. How was your experience with presenting case to Sudha ma'am and how it helped? Because she is such a senior professor and a very experienced examiner. I felt that on online she is still very sweet when we present. Offline was little difficult, but how was your experience?
It's a very nice, sir. Ma'am, sir, I just presenting cases to just know things from ma'am. Because, sir, cases didn't really matter in our college. So, sir, we were just presenting cases in MedCAS only. So, I presented approx 6 to 7 cases, sir,
Okay, great.
on MedCAS, sir. And, sir, I felt really nice, sir. I had developed approach for cardiology, sir. I would advise everyone to present as many cases as they can in UPG. I
Agree.
couldn't present that many cases in UG, but I presented a good number of cases in PG, sir. And the cardiology approach you need to develop that if some patient comes with first with palpitations, what would you think of a valvular disease? Valvular disease is very nice, sir. Sudha ma'am really taught me that, sir. And acute and chronic MR, sir. She only taught me. I didn't know that. I couldn't read it from any book. I would just say that even if people think that they're doing DNB from periphery colleges, and even my MD college was a periphery college, so teaching is not that good in these colleges. But I think at today's era, we have so much digitalized things that I don't think that we need to be stressed about teaching. So you can present as many cases online. You can have many sources, sir. And sir, I just feel कि मतलब you should just do your मतलब residency very properly, sir. I would just say that residency, it will solve everything, sir. Everything.
Yeah, so I think seeing patients still is the best solution, what it feels. And then, of course, we have to correlate with the books and exams. And very last question, that what would be your suggestion for your juniors now? And I would like to give it in three layers. That first, who are in first year, what is your general suggestion? We can't tell advice because I feel that once someone is in MD already has something with them, that how they are going to plan it. But there are certain things that we don't want them to make certain mistakes from first year. What would be in the second year, and what will be to the people who are in third year and maybe who are approaching towards NEET SS?
So I would like to say to the first years who have recently joined that first adapt to the situation, as you said also, sir. I saw your video of planning residency, sir. So you also said ki first adapt, sir. First, 6 months, just adapt to the situation. Then start reading if you want, but just see the cases that are present in the world. Just see and follow your seniors as many cases as you can see. You should see in first year, and just work of the patient. Question why I'm sending this investigation. Why is the patient shifted? Like sir, in our college, every time people used to go for hemodialysis.
Right.
So sometimes our senior would write 2 hours. Sometimes they would write 4 hours.
Agree.
So I asked the question, so no one could tell me, sir. Went back and I saw the concept of DDS. So, sir, I feel keen first year, you should just question everything that is going on the ward. You should be just curious. And medicine is curiosity. If you don't have curiosity, I don't think you fit well in medicine at least. Yes, sir. Sir, I was very curious in first year. Sir. I just needed to know everything, what was going on in the ward. And I think the sources will come, sir. I messaged you also. I messaged many people, sir. Everyone I knew, I would message every case that I could find.
Correct.
And sir, in after 6 months, you should not try to just read books. You just should get to learn the algorithms for first, like how to work up the patient. There, I think so. Update helps a lot. They have many approach things and things that you need to think. If this is a case of HE, then what can it be different? So, like it tells you the DDs, the treatment. It tells you everything. The clinical features also. They are up to date. Helps a lot.
Okay.
And sir, after you join your second year, after you come to your second year, I would advise start reading books, but first start with the first part one. It would give you the approach first. Let's say if you're starting nephrology, then first see the approach to nephrology part. So the things that what are the symptoms? They say, sir, I thought CKD has oliguria or nocturia only. It is written that it has polyuria. In Harrison, it is written, so in first part it has polyuria in the first part. So, sir, I think so. You will get to know that what things you are doing wrong in second year when you start reading books. Sir. In second year, you have to have an approach, sir, to read. You should start system wise as well as patient wise. So I would take my rounds in second year and just sit in the library and read those cases, sir. Oh, that was really helpful, sir. In second year, you should just work up the patients, as many patients you can work up, sir. And then in third year, sir, you should take your university exams very seriously and cases presentation also very seriously. I will advise the people to just start presenting cases from at least first year last or second year beginning
Right.
so that they can just get accustomed to the situation, sir.
Correct.
And then third year, sir, I think you should get to know the research articles, sir. In MedCAS, sir, you used to put many research articles, sir, and even NEGM was available, and many research articles were available. And I feel if you want to read the research articles, is well and good. But my approach was, I would put the PDF on chatpdf.com, and it would summarize the PDF. I would find the things, and I just read it very fast.
Right.
If I was waiting for the round, I would just read the research article very fast. So that helped a lot. So research articles were approx 20% of my preparation, sir. I read many research articles, sir.
Great.
And you also shared the updates also, sir. I remember I attended your class 3 months back from my exams, where you told me how to approach the updates. And sir, MedCAS also sent me the update links also, sir. I read, sir, MI update. I read. Now colchicine is also given, sir. Colchicine is also there in anti-inflammatory. In MI also has been preferred, sir. And so many hypertension guidelines have been changed. Diabetes guidelines have been changed. So I feel that you should. Medicine is thing that is ever changing, and so you need to join some platform or join some group at least to keep yourself relevant.
Agree.
So I would still be very much in and also Medcast team also. I want to see videos still of Medcast, sir. Even if I join any branch, I would keep seeing general videos of Medcast, sir.
Yes, I think we have many subscriber, and I think post MD, as you have now completed, many students who were with us during MD, many are, I think I would say more than 50% are continuing with us. Just for that, because it's the dynamicity, and I still feel that my WhatsApp group is a really good source, because the faculties there are really guiding spontaneously, without much motives, without much purpose ki, how does it benefit me? They are just sharing knowledge. So I think WhatsApp part is quite easy, and I still feel that many should benefit from that. And I think with this, we will end here. And one last question, if I ask that, what I feel very important during my MD residency, as we told that first year becomes quite tight, and my most of the helps were from other department colleagues, the surgeon friends and all, because the department felt very close space and I was not able to adjust easily. But I got from surgery colleagues and then the seniors. So, what was your source? Because at one point, I think if we do not feel that we should leave medicine residency, we are not being hammered enough. That's what happens. Like everyone has that experience. Still, I think people feel in first 3 months, "Ki, this is tough," and I think this is real issue. So, what was your sources? Because the online world is difficult; it does not help in this situation. So, what were your sources? How did you balance that part? That how to be a little calm and be prepared because the journey is very long.
Sir, NEET PG, sir, gives you college anywhere, sir. You can be living in Delhi and you can go to UP, some periphery college of UP, and you can go to periphery college of West Bengal also. I feel, sir, the love of medicine is very much. I had very much love of medicine. I just like, so first case I saw here in Gorakhpur was ALF, and I was very excited, sir. How wow, I have never seen a case of ALF, sir. And sir, obviously having friends obviously helps, but I feel, sir, I just feel you should just think even if you're being hammered and if even if you're being shouted upon, it's just that they want you to transform into something nice and not take anything personally. I feel, so as seniors also, they used to hammer us a lot, but they never think that they would target us personally or not. I just feel that you should talk to someone if you feel like, and just take care of your mental health in first 6 months.
Yeah.
But I just feel my approach was, I had so much love of medicine that even if they wanted me to work for 40 hours, I was not I was okay with it.
At some
That
point, it
much.
does not feel like work.
Yes, sir. It doesn't
So
feel
I
like, I
think
didn't feel like.
that we all have gone. And one more question, that out of your this 3 years of MD, if you remember 2, 3 case diagnosis where you really felt that you made some difference, what were your cases?
So one case that I would feel proud for myself only, that I diagnosed in first year, sir, PNH. I diagnosed PNH because we don't have flow cytometry here, sir. And sir, I suspected it a lot. I saw your video on PNH. You only taught the PNH in that, in the
First
MedCAS
case was
lecture.
post TM. You did it in first year. Great.
Sir, it was, I don't know how it happened, sir, but it was, he had recurrent hematuria and it was developing bicytomenia. He was not developing pancytomenia, he was developing bicytomenia, sir. And he didn't have thrombosis. And as you have told in your lecture, that it doesn't come with the classic presentation. And I remember Sudha ma'am also said that she has seen 3 or 4 cases of PNH. And I thought कि यार PNH तो नहीं हो सकता है, मैम ने इतना कम देखा है, मैं कैसे देख लूंगा. And sir thought कि I need to get a flow cytometry done for the case, and but we didn't have a facility of flow cytometry. So I told the patient to get 3,500. I put 3,500 from my pocket, and then we got a 7,000 investigation done, and it came positive for CD55 and 59. Negative, sorry, negative.
So that's the brighter side of medicine, that most of the people do not realize doctors have that much passion that will put money also into that. Great, great. So PNH is really a diagnosis, I think, for
Yes,
lifetime
sir.
to remember. Great.
Yes, sir. I've seen 3 cases after that also, sir.
Oh, okay, 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 fine. So I think, Abbas, we will end with this. And one more time, congratulations, and we are really proud
Thank,
of your
thank,
achievement.
thank, thank.